from the American Academy of Pediatrics.
As a pediatrician, well before I became a parent, I knew how important sleep was. I knew, for example, that kids who got more sleep performed better in school and that teens who didn't get enough sleep were at higher risk for developing things like diabetes. Then I became a mom, and I really understood sleep as a family necessity. Today is all about sleep, why it matters, why it escapes us sometimes, and what you can do to get more of it.
In the beginning, the first 2 to 3 months of life, babies really don't have a great sleep cycle. And so it honestly doesn't really start developing until about 2 to 3 months of age. So that's when the hormone called melatonin that helps them fall asleep and sometimes helps them stay asleep doesn't really develop until that time period.
Welcome to Healthy Children, the podcast for parents from the American Academy of Pediatrics. I'm Dr. Edith Bracho-Sanchez. I am a pediatrician and a mama figuring it out. This is a judgment-free space where all questions are good questions, and the answers will hopefully be even better. Let's get started. Today we have with us Dr. Anna Esparham to talk about something I love and wish I could get more of myself, sleep. Dr. Esparham is not only a pediatrician, she is also board certified in acupuncture and integrative medicine, and she is a member of the AAP section on integrative medicine. She currently works at a clinic called Empowered Wellness and is the founder of Health is Power, where she helps young women heal from chronic pain, headaches, and autoimmune disorders. Dr. Esparham, welcome to the show.
Thanks for having me. I'm so excited to be here.
We're excited to have you, and I would love to start with the basics. Can you break down for us how much sleep kids need by age?
So starting with infants need about 12 to 16 hours of sleep. And so that can mean through the night, but also throughout the day. So 2 specific time periods that infants need for naps is usually in the morning and in the afternoon. Then they kind of start having decreased needs for sleep when they become a toddler. So you still want to get around 12 hours of sleep for a toddler. They still may need nap times during the day, but then it starts decreasing. Then when they become preschool age, young children, usually around 4 to 5 years of age, they can even start getting a little bit less. Usually this is when nap time goes away. They may still get the nap time if they're going to preschool, but I would say around 10 hours for these children. And then when you get to teenagers, adolescents, this is a time period when they actually need much more sleep than they think, because this is another big period where they're developing and where they're growing, especially in their neurobiology, which means in their nervous system, also in their mental health, and also in their learning abilities. And so it can vary between teenagers depending upon their growth period. So usually we'd like them to have about 9 to 10 hours of sleep. The problem with the teenagers is that they don't sleep very well compared to before puberty because of this shift in the neurodevelopment. And so this is where we have a lot of fight with the parents and the teens and the school, and then also daytime fatigue and academic performance really hits teens a lot. And it's almost like an epidemic because it is affecting 80% of teenagers not getting adequate sleep, and about 20 to 60% of teens have a sleep disorder.
You just give us so much amazing information. Now, Anna, if it's okay with you, I'd love to break it down a little bit more by age groups, starting really with the newborns, right when they come out. I have to tell you, I have so many parents who are still surprised by how often newborns can wake up, for example. So what is normal, Anna, in these early years? And when do kids start to consolidate their sleep?
Yeah, that is a great question. A question that we get often as pediatricians that also is a big concern for families because the parents can be very sleep deprived. It is very difficult in the first few months of life. Now, in the beginning, the first 2 to 3 months of life, babies really don't have a great sleep cycle. And so it honestly doesn't really start developing until about 2 to 3 months of age. So that's when the hormone called melatonin that helps them fall asleep and sometimes helps them stay asleep doesn't really develop until that time period. The reason why is because they do need to eat every so often, sometimes between every 2 to 4 hours. So you can kind of think that way in terms of how many times they're going to be waking up throughout the night, because they actually do need to feed, because they're in an immense growth phase at that. They need that nutrition. Right. So infants, that is going to be the toughest time. Now, it can progress because even though the studies have shown that the melatonin and the circadian rhythm, sort of that natural biologic rhythm that allows us to wake up and that allows us to fall asleep and stay asleep, begins developing at age 2 to 3 months. It doesn't mean that it's fully developed at that time. So it's not like the infant all of a sudden is just going to start sleeping through the night at that time. Eventually, probably around 6 months is when it becomes better developed. And then usually around 9 months is when most infants start sleeping through the night. So kind of having to wait till then now doesn't mean that the parents are not going to get that much sleep, because there are ways that parents can actually help the infant sleep. One of the methods that most of people actually know, because of the media has really highlighted this, is that light therapy starts working around when those infants start developing that sleep cycle, about 2 to 3 months of age. So if you get your infant, your newborn, out in the sun, enough light, in the earlier parts of the day, they can actually help them sleep more at night. So that is one of the biggest factors.
I love that. And so good for moms too, right? And parents in general will be inclusive, but so good to get out of the house. And then it'll help at night. What else, Anna? I interrupted you.
No, everyone. It's so good for everyone. So the other thing that's really important is that parents actually have and this is probably going to be one of the most common sense items out of all these sleep guidance, is that you are interacting and playing as much as possible with that infant for that stimulation to create a sleep pressure at night. So that means
tiring them out.
Yeah, pretty much.
That makes sense. To me as a mom, that makes intuitive sense. All right, let's tire this baby out.
And that is across the board. So that's not even just for infants. And so families don't think of it because the infants are like, oh, they'll just sleep all the time. They'll kind of sit there, look around. They actually do need a ton of tummy time. They need a ton of interaction. They need a ton of stimulation.
So good for them and their development in general, and will also help your sleep. And I want to ask you, I have to ask you this, because I had never heard of it as a pediatrician, but then the minute I became a mom and my social media algorithms figured out that I was a new mom, it was everywhere. This term called wake windows. I have to tell you, the whole concept of wake windows really stressed me out as a mom, even though as a pediatrician, as I said, I'd never heard of it. I hadn't really seen any good evidence that we need to be super strict about when exactly our kids are sleeping. Can you, Anna, just briefly explain what the term means and give us your take on how we can find balance? Because like I said, it really stressed me out.
Yeah. Wake windows are the time frame that your baby or young child is actually awake. And when they're awake too long, or if they, say, overstep that potential wake window, then they could have trouble with their sleep. Now, you're right. There is not a ton of evidence on the exact wake windows for each age group for young children. So it's kind of hard to be very rigid about the time that they need to take a nap. And so really it's all about, like you said, to learn your baby and learn your child and really individualize it so that they can take the nap when they are ready to take a nap, because it pretty much is going to be routine for them where they really do need to refresh themselves, go take a nap, at a certain time frame during the day. And usually for the very young babies and the young toddlers, it's in the morning and in the afternoon. And so most parents do not have to be very rigid about, oh, it's been 1.5 hours. I got to go put my baby down to sleep, even though that baby is, having tummy time and doing just fine on their own. So I think it's going to be pretty individualized.
I love that. And it is not what social media would tell you.
No.
Thank you. I wish I'd had this conversation with you before I did all kinds of gymnastics to keep those windows. And another place where I really would love to hear your thoughts is on an early bedtime. I care as a pediatrician for kids who don't start schooling until kindergarten. And what I've seen in my practice is that those kids are often up late at night and sleep late into the morning. And in my experience, it does become harder for all other aspects of a routine to fall into place when that's the case, when the bedtime's really late. So what are your thoughts and what is the ideal bedtime for little ones?
Yeah, so a bedtime routine and falling asleep at the same time is one of the most important factors in very healthy sleep for kids and adolescents.
Say it again, Anna.
Adults.
Say it again.
So falling asleep at the same time every day is one of the most important factors in not only healthy sleep and sleep quality, but also general health. So it can affect your immune system. It can affect your ability to learn. It can affect your ability to recover from certain infectious diseases like viruses and illnesses, and even pain, which is a big thing for me as a pain specialist.
Yeah. So it does matter. It makes a huge difference. Now, what is that ideal time, Anna?
The ideal time for the young kids, it can vary just a little bit because it can be, and it also varies depending upon your daylight savings time and your standard time.
Oh, Lord.
But somewhere around that 7:30 to 8:30 p.m. is going to be a very ideal time for the school-age children and then the younger children, so before school, so preschool, toddlers. Usually it's going to be around that 7 p.m., 7:30 p.m. at the latest for young kids. The reason why is because if they fall asleep too late, their deep sleep actually gets very affected. And their deep sleep is what's so important in helping them with kind of getting rid of waste products in their nervous system, in their brain that's built up over the day. So any kind of inflammation that's built up over the day, they actually can release when they have deep sleep. And that's the only time it gets released. So that's why deep sleep is so important. But in order to get deep sleep, you have to fall asleep early enough, because if you go to bed too late, you're not going to get that deep sleep. That's when the REM sleep or the dream sleep starts, which doesn't have much to do with the immune system and help clearing out, those substances that can cause health issues.
Yeah. All really good news for those of us parents who enjoy going to bed early, putting our kids down and getting to bed ourselves. Not such good news for parents who may be night owls and who like to sleep in into the late morning. That means we really got to adjust our own schedules to try to get that deep sleep for our kids. Now, Anna, you talked about teens at the beginning of the show, and I want to dive in a little deeper because that is, of course, when parents next experience challenges. We'll just put it that way. So many teens do not get enough sleep. What is keeping them up, Anna?
There's a couple things keeping them up. So like I said, about 20 to 60% of adolescents total, it's a huge number, actually have a sleep disorder. So
what does that mean, Anna? And sorry to interrupt you. What does that mean to have a sleep disorder?
A sleep disorder means that you have some kind of condition that affects your sleep where you can't get enough sleep, you can't get good enough sleep so that they wake up feeling rested and awake and ready to go the next day. So it's an actual diagnosed condition.
So interesting. I have so many questions about that in particular, but let's keep talking about what's keeping them up.
There are two main things that keep them up. So In adolescence, especially at the beginning of puberty and after, the teens have trouble falling asleep at appropriate times. So this means that they have a shift of at least 1 to 2 hours, more commonly 2 hours, compared with an expected normal time that the younger children or adults have. And this is not their fault by any means. It's just something that happens during their puberty when they're developing this second development phase where they're shifting their neurology and their biology to become an adult. And unfortunately, what happens during this time is that they don't release their sleep hormones as well as they used to for a few years. And this is why they go to bed later and they can't wake up early. And that's why American Academy of Pediatrics has recommended that schools have a later start time for these teens because of that shift in teens.
Got it. So how do we help them, knowing that this is happening in their brain, that it's part of their development, that it's part of puberty even? How do we help them? What are some strategies to help them get to bed and fall asleep?
For that specific issue, the biggest treatment for it, especially if it's pretty significant and it's affecting their daytime functioning, their ability to learn, their academic performance, their mood, then usually melatonin is recommended, but it is a different dose than most people recognize because it's a very itty bitty, teeny tiny dose, and it's not given at bedtime. About 0.3 to 0.5 milligrams, so very, very tiny dose, is given 3 to 5 hours before they go to bed.
This is fascinating.
So that helps train that biologic rhythm called the circadian rhythm to help them get ready to fall asleep at night. So it's like a little tiny homeopathic dose to help say, hey, little brain, let's go ahead and produce melatonin a few hours later at the normal time. And so it's an amazing thing that happens. I am so impressed. And that helps them be able to fall asleep. So they don't need these big doses of melatonin right before bedtime. That doesn't actually help this particular disorder. That helps insomnia. But for the this is called delayed sleep phase disorder in adolescence. So delayed sleep phase disorder, that's the actual diagnosis.
This is so interesting. Now, tell us a little bit more about other, what you would call low-hanging fruit, best sleep practices, sleep hygiene. What are some of those, just so parents know that, you probably need to be doing them at the same time as you're potentially looking into whether this is happening to your child, right?
Yes, so this is big. The sleep training, the sleep routine, the sleep hygiene is a definite for helping kids, teens, young adults have really good sleep. And that's been shown. So light, like I talked about, is really important. So not just for the young babies, but for everyone, they need enough light. And so that is very difficult in the winter times. And so if they can't get that early morning light exposure, then they do need to buy a light therapy box. And some of them now are a lot cheaper, where they can get at least 20 minutes, usually right as they wake up. So 20 minutes of that early morning light actually helps pretty significantly. So it's just 20 minutes and that's it. Now, the biggest thing that goes missed is plenty of physical activity throughout the day, avoiding before bedtime, because that actually can be a little bit of a stimulation. So plenty of physical activity throughout the day, get plenty of exercise. Then this is one that also goes under-recognized, is eating late at night. Unfortunately, it can cause a problem with the sleep cycle and doesn't allow you to get sufficient sleep because your body is working hard to not only digest it, but also can change the hormones at night when you eat too late.
I didn't realize that had an effect on hormones, Anna. So interesting.
Actually, for certain gastrointestinal conditions, so gut health issues that kids can have, whether it be celiac disease or irritable bowel syndrome, inflammatory bowel disease, those have all been correlated with sleep issues.
Got it. Now, Anna, hopefully it goes without saying, but trying to turn off screens right before bed and not having a cell phone in the room. I can't tell you how many of my patients are up late texting at night. And even when they do finally go to sleep, the phone is right there and the FOMO is real. And they're just not really going into that deep sleep because they're always just thinking, what am I missing out on? So hopefully that goes without saying for parents at home. And what if you think, as you're listening and you broke it down so clearly for us, if you are a parent who's listening and thinks that their child may have a sleep disorder, what should they say to their pediatrician?
So sleep disorders in teens and children can be a little bit different than adults. So sometimes it's harder to recognize because sometimes they don't actually present with daytime sleepiness or fatigue or tiredness. They may actually present with more hyperactivity or more irritability or more impulsive behaviors, or maybe getting into trouble at school, talking out of turn. They may not be paying attention or remembering what homework assignment they had. Those are all signs. And so sometimes what the parents think is that, oh, well, they can't focus at school and they're having behavioral issues. Sleep needs to be the biggest concern there because it is very common to have those symptoms when they're having a sleep disorder. So it's a little bit tougher to recognize than adults.
Can I tell you what just came to mind for me? And this is probably a little bit crazy and just the general pediatrician and me thinking about this. But, when I get kids in my practice who have belly pains, I always make sure first that they're not constipated, right? And it's a little bit crazy to say that and that came to mind for me. But it's almost like when you're having these behavioral situations, conditions, symptoms, whatever you want to call them, come up, maybe make sure that they're sleeping well first, right? And have that conversation with your pediatrician. Now, my other question for you, Anna, was how do you talk to teens about it? Because teens have a lot of thoughts, as you know, and it's hard sometimes to get buy-in. So how do you bring them in to this plan where everyone hopefully gets enough quality sleep?
Well, developing a relationship with the teens is really important. So I think that is really good to kind of develop that rapport, make sure we're open-ended, and really be supportive of them. And so there's this kind of dynamic where the mom or dad wants them to sleep and the kid is upset. And so you can't really take anybody's side. Otherwise, then the teen is just not going to want to tell you anything, is not going to listen to anything. So really what we're going to have to do is really talk to them about some of the challenges that they're experiencing in their personal life. And a lot of times, especially with the adolescent insomnia, they're having thoughts, just like you said. Unfortunately, a lot of the thoughts are ruminating, are intrusive thoughts, are worrisome thoughts that are out of their control that actually contribute to this heightened arousal where they really can't fall asleep. And they already have trouble with falling asleep and staying asleep. And so then there's this extra anxiety and stress, which social media and the electronics and the mobile devices are not so great. And unfortunately, we're in an electronic world right now. So blue light blocking glasses or some kind of blue light blocking effect is really important for them. So that's a good start where they don't have to make too much change.
Yeah.
Unfortunately, the changes that the adolescent has to make is really a lot of self-care and a lot of lifestyle changes, which is way harder than taking a pill. And it's way harder than putting a blue light blocker on.
Yeah.
So you have to really find something very easy and something that's going to help them immediately.
Yeah.
The one thing that I found that helps them immediately is super easy to start off with are some of the mind-body therapies that are not so difficult to get into for teens and are well-studied. A couple of the ones that are well-studied are the acupressure, something called tapping, or emotional freedom technique, has like over 160 papers on it.
Wow.
For anxiety specifically, and sleep, and stress.
It's called tapping and emotional freedom. Okay.
Mm-hmm. there's free online resources for tapping or emotional freedom technique. And so they can just go online and quickly learn it. I had a telemedicine clinic where I used to teach the teens how to do the tapping. It just takes a couple minutes, and it's where you're tapping a few acupressure points throughout the body, and it really doesn't take a super long time. So it's very easy, pretty effective. I
love it.
Yeah. And it's not like a meditation where it's going to take forever to learn meditation and kind of decrease their intrusive, worrisome thoughts. So that's a good start for them. And that's actually been studied out in a New York public school where they did a lot of these mind-body interventions specific for teens' sleep.
I love that. And hopefully we can tie it all to quick results that they can see and things that they care about, right? You're going to be able to do this thing that you love a little bit better now that you're more rested. Lastly, Anna, we like to end our shows with what we call a parenting prescription. So when it comes to kids and their sleep, what is one thing you want all parents to remember?
One thing, let's see. The biggest thing for parents to remember to help their child sleep is honestly the bedtime routine. And that is well studied that if they have a bedtime routine, the rule that the kid has to go to bed at a certain time, lights out, it actually does show that it improves pretty much most of the aspects of sleep. So the bedtime routine is so important.
I am a huge fan of that routine. Thank you so much, Dr. Anna Esparham, for joining us today.
Thanks for having me.
And thank you at home for joining us today. If you like the Healthy Children podcast, please subscribe on your favorite podcast app and help us spread the word. Follow Healthy Children on Instagram, Facebook, Threads, and YouTube at Healthy Children AAP, and be sure to visit healthychildren.org, the parenting website of the American Academy of Pediatrics. Healthy Children is a production of the American Academy of Pediatrics. Our creative team includes
Laura Alessio,
Catherine Beard,
Garrett Brown,
Zach Christman,
Ann Johnsos, Kathy Jewell,
Doug Nagel,
Jackie Ortega, Susan Stevens-Martin,
Mary Claire Walsh,
Hannah Weston.
And our theme music was composed by Doug Nagel. We'll be back next week. I'm Dr. Edith Bracho-Sanchez. Thank you for listening.